We have the capabilities today of actually preventing cancers from occurring. We can do that with breast cancer. We can do that with ovarian cancer. We can do that with colon cancer. We can do it with rectal cancer. We can do it with thyroid cancer. We can do prophylactic surgery. We can give them chemopreventive drugs, oral drugs to take, or we can shift them out of the general population to early detection. Rather than doing their mammogram at age 40 or 50, we may do it at age 20. And rather than doing a 3D digital mammogram, we may shift them into MRI of the breast. We now realize that cancer is genetic, and the ability to find these genes that are mutated in subpopulations of patients where we can prevent those cancers, that is what we're capable of doing today, and that is the future of cancer care.
Trying to understand the genetics. That cancer cell is no different than any other cell in our body. It is a cell that unfortunately has decided to grow on its own and grow uncontrolled. So normally cells in our body grow and they stop at a certain point. Our skin grows and it stops. It doesn't keep growing. Some of our cells in the body can regenerate themselves and they stop at a certain point. Cancer cells basically have hijacked that machinery and said, okay, I'm going to grow but not stop. I'm just going to continue growing. So the genetics is trying to understand what did that cell do to develop that capability? What's driving it? So what we call driver mutations. And so understanding what that does in each particular cancer can lead to a target. Okay, if that's driving it, all I need is a drug or a process or something that can turn that process off. And in fact, that's what a lot of molecular genetics is now, is trying to understand the biology, the genetics of the tumor to find drugs that will shut that process off.
The number of drugs that is available across the spectrum of different cancers is exploding.
We have treatment options now for diseases that previously had very few treatment options.
Research in the last decade and a half has demonstrated that now oral medications can be effective in killing cancer cells.
Traditional chemotherapy drugs don't know the difference between normal body cells and cancer cells. These newer targeted agents, and many of them anyway, are oral, are targeted specifically toward the cancer cells. And we've been able to find that we can not only put patients into remission, but keep them in remission much longer than before with various combinations of oral agents. And that's been one of the big breakthroughs over the past several years.
So a lot of our treatment now is focused on controlling the disease, turning it into a chronic process in which you can live with that.
Just like patients would take pills for hypertension or for diabetes, the same has occurred in the field of cancer care.
Now that we've gotten smarter in terms of the genetics of some of these disorders, we have very targeted therapies that have minimal toxicities.
So in head and neck cancer, we use techniques like intensity modulation to very precisely shape the radiation to the tumor area, but also stay off of things like the mouth, the voice box, so people can maintain good quality life, maintain the ability to eat, to drink, to talk. And that's very different than 20 years ago when we just gave all the dose to everything that was in that area. We didn't have a way of shaping it, and so patients got very sick. Today, I think we're much more in tune to the whole patient.
There are many new drugs to go along with the actual cancer drugs that keep the side effects to a minimum. For example, one of the most important are anti-nausea medicines, that before those medicines were available, people would leave the cancer center and they would be potentially starting to feel bad that night. Most of the drugs that we have now can have people feeling fine for 2, 3, 4 days before they even start to feel tired after their treatment.
And most patients are very pleasantly surprised that they do very well with that the medications we can use to counteract those side effects really work effectively. Even with radiation, they expect a lot more of skin reactions or a lot more toxicity, and they sort of say, that's a lot easier than I thought it was going to be.
And they say, that wasn't that bad. That was okay. I was able to work. The only days I had to take off were the actual treatment days and the doctor visit days.
The ability to treat the side effects, the ability to get back on track with your job, with your family, with exercise, with sports. That has changed dramatically in the last 2 decades, no question about it.
Even if we can't get rid of cancer completely, we know that in the next 6, 12, 18 months, 24 months, we may have different answers for them that they may not have had before.
I think I try to promote a sense of cautious optimism, but also a sense that this is something that is beatable and is treatable, and that you will get back to living a life, and cancer will be sort of a speed bump in life.
The progress that we made has been dramatic, and I think the quality of life of patients during their treatment and following treatment is a lot better than it was even a decade ago.